Have you ever found yourself wondering, how often should I really be taking a shower? Maybe you used to shower every single day when you were younger, but now, the thought of stepping into the shower feels like a bit of a challenge. You might even be questioning whether it's really necessary to bathe so often. Well, you're not alone. As we age, everyday routines can start to feel a little different. Things that once seemed effortless, like bathing, can become physically tiring, a little risky, or just not as important in the grand scheme of things. But here's the thing. Personal hygiene is still a big part of feeling good, staying healthy, and maintaining confidence. The key is finding a balance that works for you. Something that keeps you fresh and comfortable without causing unnecessary stress or discomfort. In this video, we're going to talk about everything you need to know when it comes to bathing as an older adult. We'll cover how often you really need to shower, how to make it a safer and more enjoyable experience, and why hygiene is about so much more than just being clean. Whether you're here for yourself or you're a caregiver looking after a loved one, this information will help you feel more in control of your routine and make the process easier. By the end of this video, you'll have a clear idea of what works best for you, plus some practical tips to make showering more comfortable, safe, and even enjoyable. Now, before we dive in, I'd love to know, where are you tuning in from? Comment below and share your city. I always enjoy hearing from you. And don't forget to like this video and subscribe for more tips like these. Trust me, you don't want to miss what's coming up next. Alright, let's get started. 1. How often should older adults shower? You might have grown up hearing that a daily shower is a must, but as we get older, things change, especially when it comes to our skin, energy levels, and mobility. The truth is, most seniors don't need to shower every day. In fact, dermatologists and healthcare professionals recommend that older adults bathe about 2 to 3 times a week. Why? Because as we age, our skin becomes thinner and drier. Frequent bathing, especially with hot water and harsh soaps, can strip away natural oils, leaving the skin itchy, irritated, and more prone to cracking. And those cracks? They can lead to infections, which is the last thing anyone wants to deal with. But let's be clear. Just because you're not showering every day doesn't mean hygiene should be ignored. On non-shower days, a sponge bath or wash-up routine can be just as effective. A warm washcloth with mild soap can freshen up important areas like the face, underarms, groin, and feet, keeping you clean and comfortable without the hassle of a full shower. Another thing to keep in mind is personal preference. Some people feel better after a shower, while others find it exhausting. If showering makes you feel refreshed and energized, then go for it. But if it feels like a chore, know that there are other ways to maintain cleanliness without stepping under running water every single day. The key takeaway? Listen to your body. Showering less often doesn't mean you're neglecting yourself. It means you're adjusting to what works best for your comfort, skin health, and daily routine. 2. Making showering safer for older adults. For many older adults, the bathroom can be one of the most dangerous places in the home. Wet, slippery floors, stepping in and out of the tub, and standing for long periods can all increase the risk of falls. And let's be honest, falling in the bathroom isn't just scary, it can lead to serious injuries. In fact, according to the National Institute on Aging, bathroom falls are one of the leading causes of hospital visits for seniors. A few simple adjustments can make a huge difference in keeping you safe and steady while you bathe. First, install grab bars in the shower and near the toilet. These provide extra support when moving around or getting in and out of the tub. Unlike towel racks, which can easily break under pressure, grab bars are designed to handle weight and prevent falls. Second, use a non-slip bath mat inside and outside the shower. Water and soap can make the floor slick, so having a good grip under your feet is essential. Another game changer? A shower chair. If standing for long periods feels exhausting or unsafe, sitting down while showering can make the entire experience more comfortable and stress-free. Pair it with a handheld shower head, and you won't have to struggle to rinse off. You can control the water flow without awkward bending or stretching. And let's not forget about water temperature. Many seniors have sensitive skin, and what feels warm to a younger person might be too hot for aging skin. Always test the water before stepping in, and aim for lukewarm instead of hot to avoid burns or irritation. Making these small changes can transform your shower from a risky chore into a safe, relaxing routine. After all, showering shouldn't feel like a danger zone. It should be a moment of comfort and self-care. 3. Overcoming the emotional and psychological barriers of bathing. Showering isn't just about physical hygiene. It's also deeply personal. For many older adults, bathing can bring up a mix of emotions, from frustration to embarrassment and even anxiety. If you've ever felt like showering is more of a burden than a necessity, you're not alone. One of the biggest emotional challenges seniors face when it comes to bathing is the loss of independence. For most of your life, showering was something you did without thinking. But as mobility changes, it might require more effort and, in some cases, assistance. Accepting help, especially with something as private as bathing, can feel uncomfortable. Some people even avoid showering altogether just to avoid the feeling of needing help. If this sounds familiar, the first thing to remember is that your dignity always comes first. Whether you're showering on your own or with the help of a caregiver or family member, your comfort and privacy should always be a priority. If you need assistance, consider ways to make the process feel less invasive. Wearing a towel while being helped, using a handheld showerhead for control, or having a caregiver of the same gender can all help make bathing feel more comfortable. Another common challenge? Anxiety around the shower itself. Some seniors fear slipping, feeling cold, or simply getting too tired during the process. If that's the case, small adjustments, like warming the bathroom before you start, taking your time, and having safety equipment in place, can make a huge difference. If you're a caregiver, patience is key. Approach showering with kindness, not pressure. Instead of saying, "You need to shower now," try, "Would you like to freshen up this morning or this evening?" Giving options helps older adults feel in control and respected. At the end of the day, bathing should feel like self-care, not a struggle. If you've been feeling overwhelmed or anxious about showering, take a step back and think about what would make the process easier for you. Small changes can make a big impact, not just on your body, but on your confidence and peace of mind. 4. The best time to shower, morning or night. Now that we've talked about the how, let's talk about the when. Have you ever noticed that some people swear by a morning shower to wake them up, while others prefer to shower at night to relax? Well, when it comes to older adults, the best time to shower depends entirely on your body, your routine, and your comfort. For some seniors, morning showers are the best way to start the day. A warm shower can loosen stiff joints, improve circulation, and give you an energy boost. If you wake up feeling a little achy or sluggish, stepping into the shower in the morning can help you feel more refreshed and ready for the day ahead. Plus, if you have a caregiver assisting you, mornings might be the best time for both of you to fit it into your schedule. On the other hand, evening showers have their own benefits, especially if you struggle with sleep or deal with chronic pain. A warm shower at night helps relax the muscles, eases tension, and signals to your body that it's time to wind down. If you often feel restless at night or have trouble falling asleep, showering in the evening might make bedtime much more comfortable. So, which one is better? The answer is simple: whichever works best for you. Some seniors prefer morning showers because it gives them a fresh start, while others enjoy a nighttime shower as part of a relaxing bedtime routine. There's no right or wrong time. Just listen to your body and go with what feels best. And remember, there's no rule that says you have to shower at the same time every day. You can mix it up based on your needs. The most important thing is that your routine works for you, not the other way around. 5. Choosing the right skincare and hair care products. Showering isn't just about washing away dirt. It's also about taking care of your skin and hair. As we get older, our skin becomes more delicate, and our hair may feel drier or thinner than it used to. That's why using the right products can make a huge difference in comfort, hydration, and overall well-being. Let's start with soap and body wash. Many commercial soaps are harsh and can strip the skin of natural oils, leaving it dry, itchy, and irritated. Instead of using strong, fragranced soaps, go for something gentle, a moisturizing body wash or soap specifically made for sensitive skin. Look for ingredients like glycerin, aloe vera, or oatmeal. These help to hydrate and soothe the skin while cleansing. Now, let's talk about shampoo and conditioner. As we age, our scalp produces less oil, which can lead to dry or brittle hair. Using a sulfate-free shampoo is a great way to clean your hair without stripping away moisture. If your hair feels dry, a lightweight conditioner can help keep it soft and manageable. And if washing your hair in the shower feels tiring, A dry shampoo can be a quick fix on non-wash days. But the most important step? Moisturizing after every shower. When skin is damp, it absorbs moisture better. So applying a gentle, fragrance-free lotion right after bathing can keep your skin soft and prevent dryness. Look for products with ceramides, shea butter, or hyaluronic acid, which help to lock in hydration and protect the skin barrier. Taking care of your skin and hair doesn't have to be complicated. It's all about choosing the right products and giving your body the care it deserves. And trust me, once you find the right routine, you'll feel the difference. 6. The importance of moisturizing and post-shower care. Now that we've talked about choosing the right products, let's focus on what happens after the shower, because what you do after bathing is just as important as the shower itself. One of the most common issues older adults face is dry skin. As we age, our skin doesn't produce as much natural oil, which makes it more prone to dryness, irritation, and even cracking. And if you take warm showers, that can make things worse by stripping away even more moisture. That's why applying a good moisturizer right after a shower is essential. The best time to moisturize is when your skin is still slightly damp. This helps lock in hydration, keeping your skin soft and comfortable throughout the day. Choose a fragrance-free, gentle lotion that contains ceramides, shea butter, or hyaluronic acid. These ingredients help strengthen the skin's protective barrier and prevent dryness. If you have particularly dry skin, an oil-based moisturizer or thicker cream may work better than a regular lotion. For extra care, don't forget your feet and hands. These areas tend to get the driest, so a little extra attention can go a long way. If you have cracked heels, a foot cream with urea or coconut oil can help heal and soften the skin. And if your hands feel dry, keep a small bottle of lotion nearby to use throughout the day. Another thing to keep in mind? Dressing in soft, breathable fabrics after showering. Loose-fitting cotton or moisture-wicking fabrics help keep your skin comfortable and prevent irritation, especially if you have sensitive skin. A simple post-shower routine, moisturizing, wearing comfortable clothing, and staying hydrated, can make a big difference in how you feel. It's all about keeping your skin healthy, soft, and nourished without much effort. 7. The role of oral hygiene in overall health. Showering is just one part of personal hygiene, but there's another important area that often gets overlooked: oral health. Taking care of your mouth isn't just about keeping your teeth clean. It plays a big role in your overall health and well-being. As we age, we become more vulnerable to gum disease, tooth decay, and dry mouth. Many medications can reduce saliva production, leading to increased bacteria and bad breath. But the good news? A simple, consistent routine can keep your mouth healthy and fresh. First, brushing twice a day is non-negotiable. Use a soft bristled toothbrush and a fluoride toothpaste to clean your teeth without damaging your gums. Brushing in gentle, circular motions helps remove plaque while protecting delicate enamel. If holding a toothbrush feels difficult, consider using an electric toothbrush, which requires less effort but does a thorough job. Next, flossing once a day is just as important as brushing. Plaque and food can get stuck between teeth, and if it's not removed, it can cause cavities and gum infections. If traditional floss is tricky to use, floss picks or a water flosser can be a much easier alternative. Don't forget about mouthwash. A good alcohol-free antibacterial mouthwash helps fight bacteria and freshen breath. And if you struggle with dry mouth, using a moisturizing mouth rinse or sugar-free lozenges can help stimulate saliva production. For those who wear dentures, daily cleaning is essential. Dentures can collect bacteria just like natural teeth, so soaking them in a denture cleanser overnight and brushing them gently each morning helps prevent infections and bad breath. And even if you don't have natural teeth anymore, gently cleaning your gums with a soft toothbrush or damp cloth is still necessary to maintain oral health. Taking care of your mouth is about more than just a nice smile. It helps you eat, speak, and feel confident every single day. A small daily effort can prevent bigger health problems down the road. So keeping up with oral hygiene is one of the best things you can do for yourself. 8. Nail and foot care. Small steps for big comfort. Now let's talk about something that doesn't always get the attention it deserves: nail and foot care. You might not think about your nails and feet every day, but taking care of them is essential for comfort, mobility, and overall hygiene. As we age, nails tend to get thicker and harder to trim, which can lead to discomfort or even painful ingrown toenails. If nails aren't cut properly, they can cause pressure, irritation, or infections, making walking uncomfortable. A simple habit of trimming nails regularly, about once a week or every 2 weeks, can prevent these issues. If reaching your feet is difficult, consider seeing a podiatrist or asking a caregiver for help. Foot health is just as important. Many older adults experience dry, cracked heels, which can become painful over time. Applying a moisturizing foot cream every night, especially one with urea or coconut oil, can help soften the skin and prevent cracks. And if you notice any swelling, redness, or changes in color, it's important to check with a doctor, as foot problems can sometimes signal circulation issues. Another thing to keep in mind? Wearing the right shoes. As we age, our feet may change shape or lose padding, so wearing comfortable, well-fitted shoes with proper support can prevent pain and reduce the risk of falls. Avoid walking barefoot on hard surfaces, as this can increase foot pain and dryness. By keeping your nails trimmed, your feet moisturized, and wearing proper footwear, you can avoid discomfort and stay mobile for longer. Taking care of your feet and nails might seem like a small thing, but it plays a huge role in your overall well-being. 9. The importance of clean clothes and fresh bedding. Hygiene isn't just about showering. It's also about what you wear and where you sleep. Wearing clean clothes and sleeping on fresh bedding can make a big difference in how you feel physically and emotionally. Let's start with clothing. Wearing fresh, clean clothes each day isn't just about looking presentable. It helps prevent skin irritation, odor, and bacteria buildup. As we age, our skin becomes more sensitive, so sweat, dead skin cells, and body oils can cause discomfort if clothing isn't changed regularly. A simple habit of putting on fresh undergarments, socks, and shirts daily can help keep you feeling fresh. If laundry feels like a chore, having a set laundry schedule or getting assistance from a caregiver can make it easier. Now, let's talk about bedding. Over time, sweat, skin flakes, and allergens build up on sheets and pillowcases. This can lead to itchiness, skin irritation, and even breathing issues. Washing bed linens once a week in warm water helps keep the sleeping environment fresh and comfortable. For those dealing with night sweats or incontinence, using breathable, absorbent mattress covers and extra pillowcases can add an extra layer of protection. And let's not forget the comfort factor. Crawling into a bed with clean, soft sheets at night can feel incredibly refreshing and soothing. It's a small change, but it can make a huge impact on your quality of sleep and overall well-being. By keeping clothes and bedding clean, you'll feel more comfortable, more refreshed, and more at ease, because good hygiene isn't just about the shower. It's about every part of your daily routine. 10. What to do if you or a loved one refuses to shower. If you or a loved one is avoiding the shower, the key is understanding why. Ask yourself, is it because of physical discomfort? If so, adjusting the water temperature, using a shower chair, or switching to sponge baths might help. Is it about fear of falling? Adding grab bars, non-slip mats, and a handheld shower head can create a safer, more stable environment. Is it about independence? Some seniors feel embarrassed about needing help with bathing. In this case, offering privacy, allowing them to do as much as they can on their own, and using respectful language can make a difference. Is it because of memory issues? If dementia or cognitive decline is involved, creating a consistent routine, using gentle reminders, and keeping the process simple can ease anxiety. If traditional showers feel overwhelming, consider alternatives like sponge baths on non-shower days, dry shampoo to keep hair feeling fresh, using warm washcloths to clean important areas instead of a full-body shower. For caregivers, patience and understanding are the most important tools. Instead of forcing the issue, try gentle encouragement. Sometimes, making the process feel like a choice rather than an obligation can make all the difference. At the end of the day, hygiene is important, but so is dignity and comfort. Finding a balance that works for you or your loved one will help make the experience less stressful and more manageable. There's no one-size-fits-all answer to showering as an older adult. The key is finding what works for you, whether that means showering twice a week, making safety modifications, or choosing the right time of day to bathe. Hygiene isn't just about cleanliness. It's about feeling comfortable, confident, and cared for. A few simple adjustments, like using gentle skincare, keeping a safe shower setup, and wearing fresh clothes can help make daily hygiene a positive and enjoyable experience instead of a chore. Now, I'd love to hear from you. What's one change you're going to make to your hygiene routine after watching this video? Drop a comment below and let's talk about it. And if you found this information helpful, don't forget to like, share, and subscribe for more practical tips. Thank you for your time, and take care.